Hello, in this video, I'm going to be talking about a phenomenon referred to as Scanxiety. First, I'd love to invite you to our channel and check out our content. We're putting out new things all the time and redoing older videos so that things are fresh for you. I'd also love to invite you to go to Yerbba.com for your personalized Yerbba report. So what is Scanxiety? What are we talking about when we use that term? Well, it's a made-up term that refers to anxiety you get in anticipation of having a scan, whether it's a mammogram or an x-ray, a CAT scan, a bone scan, really any imaging of your body. It can also refer to that period between having the test done and waiting for the results. So I'm going to be talking about it as if it's the whole thing, with some specific tips for before the scan and then some specific things for after the scan. So before the scan, you may notice that you get anxious. You may even have sort of flashbacks to when you were first treated for cancer, or if you're just starting the process. There's a lot of anxiety. What's going to be found? What does it mean for me, my future, my life expectancy? Who wouldn't be anxious, really? And although tests don't need to be done after treatment for breast cancer is over, if you have a symptom or if you're on a clinical trial, scans are part of your story for a long time. So whether the scan is with symptoms or without, people get a big buildup. They can have flashbacks to a previous time, whether it was a previous scan or another medical procedure, or you're just back in the health system where you got your care originally, and you can have sights and smells and sounds can remind you of things before. How it feels in your body is preoccupation, where that's all you can think about for the few days or even a week leading up to your test. You might have a dry mouth or palpitations. You might have difficulty sleeping, especially the night before a scan or the night after a scan. These things are really normal. If you get nothing else from this video, just know that you're normal and that it's so common that we came up with a name for it called Scanxiety. It's not a real medical diagnosis, it's an experience that you're having. What are some ways to cope? So leading up to the scan, there are a couple things that you can do. One is you can make sure that you have the test scheduled in the morning so that you wake up in the morning, get ready and go, and you don't have the whole day dreading. It doesn't mean you're not going to feel bad the day before, but at least one day there's a little less suffering. The other thing you can do is plan the scan so it's not before a holiday weekend or on a Friday where you're not going to hear about it later, and just knowing that you're going to hear sooner rather than later can help you as you go into the test. It can help you to plan the logistics really well. Who's going to take you if you need a driver? Who will be with you to distract you? What can you do the day before to distract yourself? Can you do something with a friend or watch a movie? Anything that will get you from thinking solely about the upcoming test. Being active can help. Reading a really good book can help, though that can be really hard for many people. Being out in nature can be really helpful. Just feel your feet connected with the earth and know that you are okay. Another thing that can help is getting a lot of information. What will happen if the scan shows this? Don't be afraid to ask your medical team, why are we doing the test? Do we have to do the test? What will we do with the result? If it shows this, this, or this, what will the plan be? That can be really helpful for you, knowing that you're not going into this sort of unknown world. You know exactly what will happen. If you're interested in learning more about the treatment options that might be offered to you depending on what the scan finds, I would love to have you go to Yerbba.com and get your personalized Yerbba report. That will tell you which tests should be done and when and what they're looking for. And even if you can ask questions, what if the scan shows this? So this can be really helpful, information gathering, and you can ask your medical team that. You don't have to leave with a great unknown. The next thing is, after you've had your scan, what do you do? Well, one thing that can be really useful is to process things, whether it's with a friend or on your own in your journal, going outside again, knowing that you'll be okay, that there's nearly always something that can be done, no matter what the scan shows, even if it shows something you don't want it to see. Another thing to do is leave behind any what ifs. If only I had. Those sorts of things just weigh us down. Another thing you can do is imagery. You can imagine being on the other side of getting the test result. You can do some drawing. You can do meditation, anything to get you out of that ruminative over and over cycle. Calling a friend, like I mentioned, process that. The other thing that can be really helpful is find out when you will hear from the doctor or when you will see the results in your portal. It's important to know how will you get the results, by whom, and by when. And I always add a day on, because things can get slowed down, and if you've had previous scans, your scans have to be compared to the last ones. They can tell you what that scan shows, but you really need the comparison. If you've been in this situation, you know what I mean. Are things stable, better, worse, that sort of thing. So again, information gathering and then monitoring and working with your nervous system through meditation and other things you find soothing can be really helpful. My guess is you have some tips for our Yerbba community. Put those below. If you have a question for me, drop them in there as well, and we'll get back to you as soon as we can. Please be kind to one another. We're all human beings. And as a reminder, you can go to yerbba.com to get your personalized report. Thank you for watching.